Welcome to our YouTube channel. I'm Sarah Bennett, and this is where we share accurate, easy to understand, and practical medical information designed especially for the senior community. Today, we begin a very important episode. We won't be talking about high blood pressure, diabetes, or cholesterol as usual. Instead, we're focusing on a silent enemy that quietly threatens the hearts of many older adults: chronic anxiety. When negative emotions build up day after day, they can lead to a real heart attack. As always, I am honored to be joined by Dr. Eugene, a cardiology and metabolic specialist who has spent more than 30 years working side by side with older patients to protect their hearts. Welcome back, Dr. Eugene. It's a pleasure to have you here today.
Hello, Sarah. Hello, everyone. Today's topic is one I believe we need to talk more about and understand more deeply because it is directly connected to emotional health and to survival in older adults. It may sound unfamiliar, but in clinical practice, more and more doctors are seeing that prolonged stress and anxiety can damage the cardiovascular system, especially in people with existing risk factors such as high blood pressure, diabetes, or those living in isolation.
Dr. Eugene, as you just shared, prolonged anxiety can affect the heart. That may come as a surprise to many people. Usually, when we think of heart disease, we think about high cholesterol, obesity, smoking. But anxiety seems like just an emotional matter, doesn't it?
That's exactly right, Sarah. And this is one of the biggest misconceptions I have seen in more than 30 years of practice. We tend to separate physical health and mental health as if they were two different worlds. The truth is, the mind and body are always closely connected, especially in older adults. Chronic anxiety is not just a vague feeling, it is a real biological state inside the body. When someone feels anxious on a regular basis, whether from losing a loved one, loneliness, illness, or fear of aging, their body reacts as if they were facing real danger.
So, what you mean is the body reacts as if it were running away from a tiger.
Exactly. When anxiety strikes, the adrenal glands release stress hormones, mainly adrenaline and cortisol. This makes the heart beat faster and raises blood pressure. If this reaction happens only briefly, such as before an exam or when worrying about family, it's usually not a serious issue. But if the state continues for weeks or months, the cardiovascular system begins to suffer damage. The blood vessels tighten repeatedly, injuring the inner lining, leading to atherosclerosis and increased platelet stickiness, which sets the stage for a heart attack.
And I assume this is especially dangerous for people who already have existing conditions.
That's correct, Sarah. For those with high blood pressure, diabetes, high cholesterol, or a prior mild heart attack, long-term stress pushes the risk much higher. Their bodies are already fragile, and with daily pressure from anxiety, even a small trigger can be the final tipping point.
So would you say this is one reason why some people who look healthy end up having sudden heart attacks?
I am convinced of that. Many heart attacks happen in people who show no obvious warning signs, but when their psychological history is reviewed, most have gone through long periods of unrelieved stress.
That is truly eye-opening. We are going to look deeper into the biology of how anxiety quietly damages the heart day by day, even when you don't realize it. Doctor, you've just revealed something important. Anxiety does not only affect the mind, it directly harms the cardiovascular system, especially in older adults. So what is the actual mechanism behind this? How can an emotion, something so abstract, cause such concrete changes in the heart? Dr. Eugene, please help us understand this.
I'd be glad to, Sarah, and I believe this is the key part to understanding what really happens inside the body when anxiety lingers. Let's begin with the body's stress response system, known as the HPA axis. The HPA axis, short for hypothalamus pituitary adrenal axis, is the central coordinator of our stress response. When we feel anxious, fearful, or stressed, the brain triggers a chain of chemical signals. The hypothalamus sends a message to the pituitary gland, which in turn activates the adrenal glands, where cortisol and adrenaline are released. These two hormones are survival tools. They prepare the body to either escape or fight in a dangerous situation.
So, if I understand correctly, the body reacts to anxiety as if it were under a physical threat, even though there is no real tiger present.
Exactly. That is the problem with chronic anxiety. Instead of reacting once and then stopping, the brain keeps activating the HPA axis day after day, keeping cortisol and adrenaline levels abnormally high. When cortisol and adrenaline remain elevated for long periods, a series of dangerous effects strike the cardiovascular system. High blood pressure and rapid heart rate become constant because the heart is forced to beat faster and harder as if it were always preparing for a fight. This puts continuous strain on the blood vessel walls, much like a balloon that is overinflated again and again until it weakens and risks bursting. It also triggers chronic inflammation inside the blood vessels. Prolonged cortisol release activates inflammatory cytokines such as IL-6 and CRP. These chemicals damage the endothelium, the inner protective lining of the arteries. Once the endothelium is injured, bad cholesterol, LDL, adheres more easily, setting the stage for plaque buildup and atherosclerosis. Another effect is increased platelet stickiness. Under chronic stress, platelets clump together more readily, making blood clots more likely. If one of these clots forms at the site of an atherosclerotic plaque, it can completely block a coronary artery and trigger an acute heart attack, also known as a myocardial infarction.
That sounds terrifying. So it means our hearts are under daily attack if we live in a constant state of anxiety?
That's exactly right. And in older adults, the body's natural defense systems are already weaker. When stress becomes a daily companion, the heart pays the heaviest price. Beyond hormones, anxiety strongly affects the autonomic nervous system. The sympathetic nervous system is constantly activated, making the heart beat faster and raising blood pressure. Meanwhile, the parasympathetic system, which allows the heart to rest, is suppressed. The result is that the heart works non-stop at high speed without recovery time. It's no different than forcing a car engine to run at full throttle for hours without stopping. Chronic anxiety also raises the risk of dangerous arrhythmias, such as atrial fibrillation, which is especially risky in older adults. In addition, stress can cause sudden coronary artery spasms that temporarily reduce blood flow to the heart, even without a blockage. A large study in Japan showed that people with chronic anxiety had twice the risk of coronary artery spasms, even when they did not have atherosclerosis.
Doctor, I've also heard that serotonin is connected to anxiety. Does it play a role in heart health?
Serotonin is a neurotransmitter that affects mood. When serotonin levels are low, as in people with depression or anxiety, patients often sleep poorly, move less, and eat poorly. This increases the risk of high blood pressure, abnormal cholesterol, and insulin resistance, all of which raise cardiovascular risk. To summarize, with chronic anxiety, stress hormones drive up blood pressure, inflammation, and clotting. The autonomic nervous system becomes imbalanced, forcing the heart into overload. Unhealthy lifestyle behaviors caused by prolonged negative emotions add more pressure. The heart ends up as the direct victim of all of these combined effects.
Thank you, Dr. Eugene. What you've shared truly makes me rethink the phrase a vulnerable heart, because now I see it's not just a metaphor, it is a serious biological reality. But I know some viewers may wonder, has this actually been proven by science? And the answer is yes. Many studies have confirmed this link. Dr. Eugene, could you please share some of the evidence from major research?
Of course, I'm glad to provide hard numbers, because this is where science supports what may otherwise sound like feelings or opinions. First is the CARDIA study, Coronary Artery Risk Development in Young Adults. Although it followed younger people, there is an important point to note. CARDIA tracked over 5,000 participants for 25 years to examine the link between mental health and heart health. The results showed that people with higher levels of anxiety in midlife had up to a 40% greater risk of cardiovascular disease as they aged. What's striking is that this link was independent of gender or weight. In other words, even if you weren't overweight or a smoker, anxiety alone still stood out as an independent risk factor.
That is a very powerful number. What about in older adults, doctor?
Yes, there is strong data there as well.
A study published in JAMA Psychiatry in 2021 followed more than 13,000 people aged 60 and older for 10 years. It found that those diagnosed with chronic anxiety had a 73% higher rate of heart attacks compared to those without anxiety, even after controlling for blood pressure and diabetes. And one very important detail, the risk was even higher among those who lived alone or lacked strong social support systems.
So loneliness can actually make anxiety worse and in turn affect the heart?
Exactly. We call that social stress, and it is especially common in older adults who have retired, lost a spouse, or live far from their children and grandchildren. Research from the Harvard School of Public Health showed that socially isolated seniors had a 29% higher risk of heart disease and a 32% higher risk of early death. When chronic anxiety is added to the mix, the danger compounds even more. The second important study is on generalized anxiety disorder, or GAD. In the United Kingdom, a study of more than 80,000 adults over age 65 found that those with GAD were 2.1 times more likely to be hospitalized for heart attacks compared to those without anxiety. The risk was even higher in postmenopausal women because hormonal changes often combine with insomnia and emotional instability.
I'm truly surprised to see how clearly anxiety is tied not only to mental health, but also to cardiovascular mortality.
That's right. A 2020 report from the American Heart Association officially recognized chronic psychological stress as a cardiovascular risk factor right alongside the classic ones, such as smoking, obesity, high blood pressure, and diabetes. The AHA also urged clinicians to include psychological assessment in routine cardiovascular screenings for older adults, especially during annual checkups.
So in the end, anxiety doesn't just make us sad or keep us awake at night. If it's not managed properly, it can actually become the spark that ignites a real heart attack.
Exactly, Sarah. And the important point is this: it is entirely preventable if we acknowledge anxiety as a real health issue, actively find ways to manage it instead of just enduring it in silence, and reach out for support from doctors, family, or mental health professionals when needed.
Thank you, Dr. Eugene, for those invaluable insights. We've just gone through a wealth of scientific data showing that chronic anxiety can truly damage the heart and even trigger a heart attack. But perhaps nothing is more convincing than real stories, real people who have lived through it. Dr. Eugene, could you share with our viewers some of the most memorable cases from your career?
Of course, and I'll change a few personal details to protect my patient's privacy. Case 1. Mr. Walter, a widower living alone at age 72. He is one of the patients I will never forget. Mr. Walter was a retired engineer, appeared healthy, didn't smoke, and ate a balanced diet. But after his wife passed away, he slowly withdrew into silence, became isolated, and avoided social contact. He never openly said he was sad or anxious. One day, he was rushed to the emergency room with severe chest pain, a rapid heartbeat, and low blood pressure. We diagnosed him with an acute heart attack, even though his previous health markers had not looked especially dangerous. After stabilizing him, I asked, "Have you been under any stress recently?" After a long silence, he said just one sentence. "Doctor, every night I still talk to my wife as if she were alive, but nobody knows that." At that moment, I realized his heart was not only blocked by plaque, but also by loneliness, suppressed grief, and unspoken anxiety.
That is truly moving. I believe many older adults live with the same feelings without realizing they are putting their hearts at risk.
Exactly. And that is why I always ask my older patients not only about their medications, but also about their emotions and personal lives. Case 2. Mrs. Linda, 67 years old, single mother, caregiver for her seriously ill husband. She came to see me because of frequent brief chest pain, insomnia, and palpitations. Initial tests showed nothing alarming, but I decided to keep her under observation because I sensed something was wrong. Just 2 weeks later, she was hospitalized with an acute heart attack. Thankfully, she was treated in time. Later, in conversation, she told me, "Doctor, I'm not worried about myself. I just worry that if something happens to me, no one will take care of my husband. My daughter lives far away." It turned out she had been living under constant stress, exhaustion, and chronic anxiety for nearly a year, but no one noticed.
Both cases share one thing in common. They never thought of anxiety as an illness, and because of that, they never tried to relieve it or talk about it.
That's exactly right. And that is the message I want to share with our viewers today. Chronic anxiety is a real cardiovascular risk factor. It is not weakness. It is a signal that you need support.
Thank you, doctor, for those powerful and very human stories. Dear viewers, if you or your loved ones are silently enduring long-term stress, please do not ignore it. Treat it as a warning signal for your heart. I think the important question now is how to recognize whether you or someone close to you belongs to the most vulnerable group. Dr. Eugene, could you explain clearly who should be especially cautious when anxiety becomes long-lasting?
That's an excellent question. In reality, not everyone with anxiety will develop a heart attack. But there are certain groups where the addition of stress makes the risks skyrocket. I usually divide the high-risk groups into 4 main categories. First are people with pre-existing cardiovascular or metabolic conditions. This is the highest risk group, those with high blood pressure, diabetes, abnormal cholesterol, or obesity, especially those who have already had a mild heart attack, undergone stent placement, or have a history of coronary artery disease. In these individuals, the arteries are already weakened or partially blocked, so just a spike in blood pressure, vessel constriction, or clot formation from stress can suddenly trigger a heart attack. Older adults living alone or with little social connection are another high-risk group. These are people who are widowed, have no children nearby, or have a very small social network with limited interaction. They are more likely to fall into a state of silent, prolonged anxiety and emotional isolation that can last for months or even years without anyone noticing. And as we've said, loneliness combined with stress is a dangerous pair for the heart. Postmenopausal women are also at higher risk. Many are surprised to hear this, but after age 50, especially following menopause, the risk of heart attack rises not only due to hormonal changes, but also because of poor sleep, heightened emotional sensitivity, and greater vulnerability to anxiety and depression. Many women in this stage tend to endure silently and share very little. On top of that, their heart attack symptoms are often atypical compared to men, which makes them easier to miss. Those with a history of psychological trauma or chronic anxiety are another vulnerable group. These are people who have experienced major losses, accidents, or trauma, or who live with disorders such as GAD, generalized anxiety disorder, or PTSD, post-traumatic stress disorder. In them, the HPA axis is chronically overactivated, meaning stress hormones never settle down. As a result, the heart is forced to work in a constant state of tension.
So, if I have an older relative who lives alone, has a history of high blood pressure, and tends to be anxious, they are right in the gold risk zone?
Exactly. That is the kind of person who should be monitored not only for physical health, but also for emotional well-being, and who needs regular check-ins and support.
We now know that chronic anxiety can damage the heart from the inside, especially in older adults who already have risk factors. But how can we recognize early when the heart is beginning to send out distress signals? Dr. Eugene, what symptoms should make us cautious even before a clear heart attack occurs?
This is an extremely important question. Many people believe heart attacks only happen suddenly and violently, but in reality, the heart often sends warning signals much earlier. We just fail to notice or dismiss them. Here are the silent warning signs I strongly advise you never to ignore, especially if you are living under prolonged stress or anxiety. Recurring vague chest discomfort. A heart attack does not always feel like the dramatic, crushing pain shown in movies. Many patients describe sensations such as heaviness in the chest, as if a brick were pressing down, a dull tightness without clear cause, or a burning feeling in the center of the chest or upper stomach, often mistaken for acid reflux. If these episodes occur when you are anxious, upset, or sleep-deprived, and they ease when you rest, it may be a warning that your coronary arteries are temporarily starved of blood. Unusual shortness of breath. Becoming winded after light walking, climbing just a few steps, or finding it difficult to take a deep breath, especially while lying down. Needing to sit upright at night just to breathe more comfortably.
If you have never experienced this before and are already dealing with frequent anxiety or palpitations, it could mean your heart is under excessive strain. Persistent fatigue. This is one of the most overlooked symptoms. Many seniors assume, I'm just old, so of course I get tired. But if you are sleeping well, yet still feel drained, lose interest in household chores, going out, or meeting family, or notice fatigue worsening after episodes of stress or emotional upset, this may point to early heart failure or silent ischemia, especially when combined with chronic stress. Unexplained digestive problems. It may sound surprising, but many heart attacks begin with stomach pain, nausea, or loss of appetite. This is more common in older women and is often misdiagnosed as a gastrointestinal issue. If these symptoms appear together with intense anxiety, palpitations, or cold sweats, heart disease must be considered and checked without delay. Cold sweats without clear reason. Feeling chilled and breaking into a sweat, even though you have no fever and have not exerted yourself, is a serious warning sign. It often accompanies real heart attacks. If you notice yourself sweating cold during anxious moments or waking up at night restless and drenched, it is critical to get your heart examined as soon as possible.
Dr. Eugene, it seems that many symptoms of chronic anxiety and early heart disease overlap, and that's why patients often dismiss them?
Exactly. That's why I always say, if you live with chronic anxiety and begin noticing changes in your body, don't assume it's only psychological. Your heart may be calling for help. Get a full checkup, especially an electrocardiogram, ECG, echocardiogram, cardiac enzyme tests, or even coronary imaging if your doctor recommends it.
Dear viewers, listening to your heart, both literally and figuratively, is the first step in protecting your health. If you are living with prolonged anxiety and notice any of these signs, please seek medical care and talk with your doctor. We've just learned how to recognize the silent symptoms of heart damage caused by chronic anxiety. But there is another common challenge. Many people, even healthcare workers, confuse a heart attack with a panic attack. Dr. Eugene, could you help us clearly distinguish between the two?
I'm glad you asked, Sarah, because every week I see at least one patient in the emergency room with chest pain, shortness of breath, and rapid heartbeat, and it turns out to be a panic attack, not a heart attack. But the two conditions share very similar symptoms, which often causes fear and confusion, especially in older adults who live alone. A heart attack usually occurs suddenly, often after exertion or anger, brings dull or tight chest pain that may radiate to the left shoulder, jaw, or back, does not improve with deep breathing or changing position, is often accompanied by shortness of breath, cold sweats, or nausea, does not resolve on its own and requires immediate medical intervention. A panic attack usually occurs during anxiety, trauma flashbacks, or sometimes without a clear trigger, causes a pounding heartbeat, sharp chest pain, breathlessness, or tingling in the hands and feet, creates an overwhelming sense of impending death, even though there is no actual physical damage, lasts between 5 and 20 minutes, and often improves with deep breathing and relaxation techniques.
So if someone isn't sure whether they're having a heart attack or a panic attack, what should they do?
I always tell my patients this. If you're unsure, treat it as a heart attack first. That means sit down, stay calm, and call emergency services immediately. Do not drive yourself and do not take medication unless it has been prescribed. If your doctor has previously advised you to take aspirin, you may chew one 81 milligram tablet while waiting for help to arrive. After that, the doctors will run tests to determine exactly what is happening and provide the right treatment.
After this discussion, it's clear that anxiety is not just a passing emotion. If it persists, it can erode the heart from within, especially in older adults with pre-existing conditions. And now it's time to ask the most important question. What can we do? Dr. Eugene, please share the most effective strategies for preventing and managing anxiety so the heart stays protected.
Thank you, Sarah. I believe managing anxiety doesn't have to feel overwhelming or out of reach. Sometimes it's the small daily changes that can significantly lower the risk of a heart attack. I usually recommend 6 main strategies for my older patients. Create a steady daily routine. It may sound simple, but the brain and cardiovascular system thrive on consistency. A few tips. Go to bed and wake up at the same time every day. Eat your meals on schedule. Never skip breakfast. Set aside a fixed time daily for light walking, relaxing, reading, or listening to music. When the body finds its steady rhythm, the HPA axis, your stress response system, begins to calm down. Practice breathing and muscle relaxation. These techniques activate the parasympathetic nervous system, helping to lower heart rate and blood pressure. Try the simple 4-4-6 breathing exercise. Inhale through your nose for 4 seconds, hold for 4 seconds, exhale through your mouth for 6 seconds. Do this for 5 to 10 minutes each morning or before bedtime. You can also try mindfulness meditation, progressive muscle relaxation, or listening to calming sounds such as soft instrumental music, running water, or wind chimes. Follow a mood-supportive diet. What you eat doesn't just support your heart, it directly affects the brain-gut-heart connection. Research shows that more than 90% of serotonin, the feel-good hormone, is produced in the gut. Suggestions. Eat plenty of leafy greens, fatty fish like salmon or sardines, berries, walnuts, and oats. Avoid high sugar intake and processed foods. Stay hydrated and limit caffeine after 2 p.m. Strengthen social connections. This is truly a prescription-free medicine for both the mind and the heart. Call or meet with friends and neighbors weekly. Join community groups or light activity classes, such as dance, art, or gardening. Volunteer, even just a few hours a month. It creates purpose and reduces loneliness.
I think this part is so important, especially for older adults living alone. Sometimes just a phone call or sharing a meal with grandchildren can ease anxiety in a very real way.
Exactly. The heart doesn't just need blood, it needs connection. Keep a journal of feelings and thoughts. Many people don't like writing, but jotting down emotions each day helps release stress indirectly, instead of letting it build up inside. Keep it short. Today I felt anxious because, or I am grateful for. After a few weeks, you'll notice you can recognize emotions more clearly and manage your reactions better. Seek professional help when needed. If anxiety becomes long-lasting, accompanied by insomnia, palpitations, or social withdrawal, don't hesitate to see a psychiatrist or therapist. Today, there are many effective options, including cognitive behavioral therapy, community support groups, anti-anxiety medication when necessary, and always under medical supervision.
Thank you, Dr. Eugene. I believe these strategies not only help reduce anxiety, but also improve daily quality of life, bringing more joy and a sense of control in the later years. Before we wrap up, Dr. Eugene, could you help our audience by summarizing the most important takeaways from today's conversation?
Of course, Sarah. And let me begin with this. Chronic anxiety doesn't just affect your mood, it can actually damage your heart. Here are 5 things you should always remember. Chronic anxiety is a real cardiovascular risk factor. It's not as harmless as we often think. It triggers stress hormones, fuels inflammation in blood vessels, disrupts heart rhythm, and contributes to plaque buildup. Older adults with underlying conditions or those living alone must be extra cautious. This group often carries hidden anxiety without realizing it. Their hearts are already vulnerable, and with added anxiety, the risk of breaking down is greater than ever. Your heart often speaks before an attack if you know how to listen. Warning signs include vague chest discomfort, shortness of breath, persistent fatigue, unexplained digestive issues, and cold sweats. Never ignore these signals, especially when they appear during times of stress. Panic attacks and heart attacks can feel similar, but they require different responses. When in doubt, treat it as a possible heart attack. Seek medical evaluation rather than making your own assumptions. Anxiety can be managed, and you don't have to face it alone. Through diet, light exercise, meditation, deep breathing, and expressing your emotions. And when necessary, don't hesitate to seek help from doctors, therapists, or trusted friends.
Dr. Eugene, if you could leave just one final piece of advice for someone listening right now, what would it be?
I would say this. Please don't try to be strong all on your own. Your heart is resilient, but it wasn't designed to live in isolation or under constant anxiety. Take care of yourself by resting, laughing more, connecting with others, and slowing down. Your heart deserves to live in peace.
Thank you, Dr. Eugene, and thank you to all our listeners for joining us in this special podcast episode. If you found today's content helpful, please share it with your loved ones, especially parents, grandparents, or anyone silently living with anxiety. We'll see you in the next episode. Goodbye, and stay healthy.